and UNICEF reveals that while global vaccination held steady in 2024, more than 14 million infants received no vaccines at all, a figure that threatens to derail critical public health goals. From conflict zones to misinformation-fueled hesitancy, the challenges are vast. Joining us now is Dr Naor Bar-Zeev, Immunization Analysis and Insights Unit Head at the World Health Organization, to speak about this report, particularly what it means for global health, equity, and the future of disease prevention. A very good evening to you, Dr. Bar-Zeev. Much appreciated for your time.
Thank you. Thanks. It's good to be here with you.
So as I mentioned, that figure of 14 million zero-dose children in 2024, what's behind the stagnation in coverage, and where is the world falling short in reaching these children?
Well, you're quite right that there's a long way to go, but I do want to, with your permission, delve very briefly into this concept of stagnation, particularly if we focus on the African region. In fact, we've seen a lot of progress in the African region. Coverage for immunization, or the proportion of children receiving immunization in Africa, is back to where it was before the pandemic. That's a milestone achievement. We're seeing more vaccines delivered in Africa than almost in any other region, and we're seeing improvements across the board. So why are there still these unvaccinated children? And I think it's important to also recognize that each and every year the birth cohort is increasing. We have more children born each year in Africa, also in the Eastern Mediterranean region. There are more children to reach every year, and we are reaching those children. And the health workers who are diligently and with huge commitment working on the ground to reach those kids are succeeding. And so when we say that the coverage or the proportion vaccinated stays the same, belying that or underneath that is an increased number of doses that are given each and every year. And so it's a testament to, and a credit to, the immunization services delivered particularly in Africa for that improvement. And yes, there is more work to be done, but it's like swimming upstream against the current, if you like. It's a challenging problem. So stagnation is a bit too simplistic a term. I think there's a lot to celebrate, and there's a lot more work to still go and do.
So as you say, that in context, really, there isn't really a dip, particularly in immunization. It's just that, as you say, there is a global growth of this cohort. So let's talk about where there are problems that are, of course, exacerbating in the sense that we spoke about humanitarian crises that arise out of conflict. What are you doing as a WHO to support some of these highly complex and unstable environments?
Yeah, thanks. Well, as you say, the problems are complex, and so they don't call for a one-size-fits-all solution. I think the issue is to go in and understand what the needs are at the contextual specific level. And again, some really good examples from the African regions are that there are 7 or so countries in the African region that are considered conflict affected and yet have increased the immunization rates in those countries. So it's certainly possible to do that. Yes, conflict is obviously a major issue and sadly increasing around the world. And the children born in those settings make up about a quarter of the world's surviving infants, but more than half of those who are not vaccinated. So it's a major problem. And the chance of a child in such a setting being unvaccinated is about 1 in 4, 1 in 5. Compared to only, say, 7% in other settings. So it is a big problem, but it's a problem for which countries are finding ways to overcome. It's not an intractable problem. It's a problem that needs clear-minded political commitment, focused efforts, and humanitarian settings, humanitarian responses on the one hand, and building primary care health delivery systems on the other as well. So those things go hand in hand. The solutions need to be tailored to the specifics of the local problems with the engagement of local communities and local leadership.
And I want to talk about inequality. Why is it that we see vaccines being deeply unequal, or access to it in some countries, in some areas?
So I think, you can delve into the question of distribution and equity at every level. Across the globe, we see stark differences among the different regions of the world. Within a given region, we see differences across countries. Within countries, we see subnational differences. And even within close areas, within communities, we see some communities doing better than others, and pockets of lower vaccine uptake even within given communities. So I think behooves us to focus, each and every one of us, on our remit and our area of responsibility. You know, leadership occurs at every level, whether it's a parent within a family or within a school or a clinic or a nurse within a community, to think about who are the ones that are left behind? Where are the children that are more vulnerable? Where are those communities that perhaps we're not reaching? And redouble our efforts to do that. We see overall improvements, but it's easier to reach those who are easier to reach, and the harder problems are harder to solve, but they're solvable, and we can do it, and there's demonstrated evidence that there are improvements. So yes, there's a long way to go. Yes, there's a lot of focus that needs to happen on leaving no one behind, but it's very clear that when those efforts are put into practice and where they're particularly tailored for local need with community engagement, achievements can be made. And we've seen that happen in the past, and we're seeing it happen again, particularly in Africa, with the recovery since the pandemic.
And I want to refocus attention back to the data, and you'll correct me if my reading or understanding of this is wrong, but you spoke about how lower income countries are seeing progress, particularly through Gavi-supported efforts. But it seems that in some wealthier countries, there seems to be a backsliding in coverage. How correct is that? And is this a trend, a growing trend?
Look, it's a concern that we're seeing backsliding in any context. Obviously, in areas where we have prevalence of vaccine preventable disease, then that backsliding translates to outbreaks and mortality and morbidity for children. But high-income countries are not immune, pardon the phrase, to this, particularly with measles, which is a very highly infectious disease and still a fatal condition, rarely, but still commonly enough to be an issue even in high-income settings, and even in the absence of malnutrition, which exacerbates measles fatality. And we're seeing, with reductions in measles coverage that occurred during the pandemic and the several years of reduced coverage, leading to an accumulation of enough susceptible children that generates ongoing outbreaks. The concerns also obviously relate to trust and many concerns around vaccine safety and questions around the validity of information. But it's very important to engage communities openly and with good faith and with transparency around the science and around the evidence, and to reassure families and parents that vaccines are tested for safety and tested for efficacy, often over decades of testing, and that concerns are raised and dealt with. You know, it's on us, the immunization community, to earn that trust. It shouldn't just be a given that, you know, scientists say so, so therefore it is so. No, the science has the onus of proof to demonstrate safety, and we do demonstrate that safety, and we earn the trust, and communities have good reason to trust us. But they also have good reasons to continue to question and to be skeptical, and it's on us to address those concerns. So yes, vaccine uptake is in a backslide in some high-income settings. Also, it's a major concern, but it calls for open dialogue, transparent science, and engagement, not maligning or saying that everybody's who has concerns is therefore an anti-vaxxer. I think that's counterproductive.
And I want to talk about that. What are you doing as a WHO to tackle vaccine hesitancy, whether it's as a result of disinformation or misinformation?
Well, again, it's not my business to police other people's speech, and so I don't want to really directly address these terms of misinformation, disinformation. Are there bad actors out there who peddle illicit stuff? Yes, there are, but they're not the majority of people. Most people are fair-minded, and they want to know that the evidence is available, and the WHO makes that evidence transparently available through the deliberations of the strategic advisory group of experts, through making available all of the accumulated data on these issues. This occurs both obviously in the scientific realm, but also in the policy realm. And so the policy decisions and the recommendations that the WHO makes are transparent and evidence-based, and that evidence is available to be read and interpreted by all. And we're very keen to engage where there are concerns, including any arising concerns on safety, which, occasionally such concerns arise. And that's good, because we need to ensure that we're continuing to do what's right and safe for my own children, for your children perhaps, and both as a parent, as a physician, and as an epidemiologist. That's important to me. I want to make sure that we're preventing disease and not causing problems. And if the best way to do that is transparently and overtly.
Just looking at country-led solutions, are there some that stand out just in terms of innovative strategies in helping, to reach zero-dose or under-vaccinated children?
There are a lot of good examples out there, both in the African continent and also further afield, countries that have taken upon themselves to both improve overall coverage, but also to close the equity gap. Those two things are not necessarily hand in hand. I can improve coverage, but widen the gap by reaching those kids where it's easier to reach. But there are countries where efforts have been put into place to improve the health of populations through improving vaccine coverage, and at the same time not just reaching the largest number of possible kids, but also reaching children that are harder to reach, where more efforts need to be made, where perhaps it's less cost effective to go out there and get them, but let's go get them anyway because they shouldn't be left behind. And this raises issues of policy and implementation efficiencies. It raises even ethical issues. For my $100 or 100 naira or whatever, I can save this many lives if I vaccinate only in the capital city because it's easier to reach those kids. I can maximize the good. But then I have an equity imperative to reach those children that are harder to reach, and it may cost me more, and I may get fewer lives saved for that money. So you can see how these things become complex ethical questions, and they should be done in full engagement with communities and transparently and made explicitly decided so that people can understand what the trade-offs are. But fundamentally, we want to improve immunization coverage to every child everywhere. And to do that, we need to ensure that we have strong systems, and building on those strong systems, push further out to reach those children that are harder to reach, engage their parents, engage their communities, engage their community leaders, and come up with innovative deliveries. And that's not only innovative scientifically, but innovative, sociologically, perhaps through school-based programs or other things, through village-based programs, through faith-based and other community structures that are important for communities. Let's engage through those mechanisms. And yes, let's also develop technologies that are better, perhaps a lesser reliance on a cold chain, on refrigeration and so on. That does help to reach solar refrigeration. So there are innovations, but it's also innovations in the social space, in the engagement space, not only in the technological space.
And just finally, your observations as a WHO and UNICEF with regards to investment gaps. What are you seeing, particularly whether it be donors or governments, to ensure that immunization is part of primary health care?
Look, every crisis is an opportunity, and there's no question that global public health is in a time of crisis and is working very rapidly out what it's going to do with a smaller budget than it used to have. But that's a good opportunity for us to work more efficiently and to participate more widely in domestic investment and the domestic share, having countries lead the way through political commitment, through local tailored policies, through implementation that works and that's locally funded. What we want, the WHO is there to provide a hand up technical support. It's not there for a handout, right? And neither is the global funding community. The reason why there's such a crisis is because the availability of funding has led to a kind of a dependence. That's not wanted by anybody. We want independent decision-making and independent funding, allowing countries to drive progress for themselves, for their communities, eventually also for their own economies, and that will be good for all. So yes, there is a period of crisis, a rapid transition to a period of less global funding, but this is also an opportunity for countries to step up and do what it is that they actually do want to do, and to prioritize health in and among all of their other social priorities. But important to recognize an investment in vaccination is a huge return on investment in the future for economic growth, for education, for health and well-being, for the whole of society. And if we see immunization as an investment in the future rather than a cost, it changes the mindset. And we'd like to see more of that happening, and we're here to support that happening. We're keen to encourage countries to take the lead and be less less dependent on the vagaries of global funding systems.
All right. Thank you so much for that, and much appreciated your thoughts, your insights. Dr. Naor Bar-Zeev, who's head of WHO Immunization Analysis and Insights Unit, speaking about that report that they just put out today. Speaking